Hello, everyone. I'm Bill Reed, Executive Vice President and Partner with Huntzinger Management Group. And we are very fortunate that Disruptive Innovations has given us this opportunity to use one of their podcast segments. And I would like to introduce the other individual who'll be with me today on the podcast. That's Aaron Wootton. He is the Chief Digital Officer, also with Huntzinger Management Group. Hello, Aaron.
Hi, Bill. How you doing?
I'm doing well. Thank you. We want to talk through your role and some of the technologies that you deal with in the healthcare industry and thought this might be a good way to do that. Maybe you could start by telling us about your current role.
Yeah, sure, Bill. I've been working for Huntzinger for, gosh, it must be almost 3 months now, a little bit under 3 months, but I'm the Chief Digital Officer. So I'm very focused on kind of emerging technology. How do we make use of some of the traditional technologies in healthcare to take them a step further? When you think about AI, is obviously at the forefront of everyone's mind, very focused on AI, very focused on consumer-facing digital, how we can create radically convenient experience for patients within the health systems that we partner with. And also how we use those core foundational technologies such as analytics in enabling those experiences. So how we can use analytics and data to create large language models for AI capabilities, how we can use analytics to influence the patient experience based on what we know of that particular patient. And then finally, telemedicine sits within that space for us. And how do we see patients differently than we have before using telemedicine technologies, and even how we can change the activities within call centers using different telemedicine technologies or call center technologies such as active assist type technologies and that effect. That's the focus of what we call digital. And I've been working with a few different health systems in those months to really define our portfolio and how we can be of assistance to other organizations. It's been a lot of fun. I'm enjoying the role.
Interesting. Thanks for that, Aaron. Tell our listeners a little bit. That's an exciting role and one of interest today in the healthcare space. How did you enter into it and what prompted you to do that?
Yeah, so I've been in healthcare IT for about 25 years now, just under 25 years. I've hung my hat in that arena. And my career, really the pieces that I've enjoyed the most were when I was really focused on facilitating change in operations with technology. So you look at some things like population health. How can we see the patients that are most in need and intervene early in their care journey to be able to have the biggest impact possible? And that's redefining how we think about the traditional patient provider interaction. And it requires a set of technology to be able to do that. So those types of projects have always been the most rewarding to me. So when I found this role with Huntzinger as the Chief Digital Officer, that's the area I get to play in every day. And that's what I enjoy. I enjoy working with the different health systems, seeing the different ways they use technology and the ways they apply technology to accomplish some of those things. And that's been a really rewarding experience for me throughout my career, like I said.
Great, great. Keeping in line with our sponsor, Disruptive Innovations, often digital transformation is described as disruptive technology. Explain that a little bit. Some people will get intimidated by the term disruptive and others will look at it as a positive. Give me your view on it and talk about what you're seeing in healthcare relative to that aspect.
Yeah, I think everyone's familiar with the Kodak story at this point, where Kodak thought they were making film, and they recognized that what they were really doing is capturing memory, and the whole digital experience or digital technology passed them by as the digital camera came into the fold. And I think that's one of the pieces of healthcare. When you talk about disruption, there is disruption in terms of the film industry. There's disruption right now in healthcare. And I think the disruption that we're seeing is, how do you make sure that patients are able to be seen in a way that accommodates them? How do you change the care model so that it's radically convenient so that the cost of care is not prohibitive. The care experience is one that patients say, oh, well, that wasn't so bad. Because no one really likes going to their doctor, but at least be able to say, hey, that wasn't so bad. And they really care for me. And those are the pieces that in an industry, it's always challenging to reinvent yourself. So you think about what disruptive innovation's doing, what we're doing in the digital space, what we're helping health systems do is understand all these new technologies that are at play and apply them in a way that reinvents the way they do business. So they can do it more efficiently, more effectively, and do it in a cost manner. Yeah. We'll have to edit that for you.
Cost effective manner. Yes.
Thank you. That's what I was looking for. Yeah.
Um, you touched momentarily on the patient there for a moment, and that no one likes to go to their doctor. Part of the issue in healthcare these days is consumerism and self-service. As a patient or as an individual, I do a lot of things myself. I shop online, I schedule things online, I do all these things. That doesn't work quite as well in healthcare, or historically it has not. What does digital transformation do to that perspective?
I think that's part of what we're trying to achieve is trying to figure out how we can make it more effective, how we can apply things, technology in a way that eases the burden of providers. Because I can tell you, looking at the AAMC, the Association of American Medical Colleges, there is already a shortage of providers in the country. And we're not talking about a problem that's a few years out any longer. We're talking about physician shortages that hamper efforts to remove barriers in care and populations in underserved spaces that are not getting the care that they need. And the estimate is 102,000 physicians across the country in terms of what we're short. So how do we fix that? I mean, we're not going to be able to create physicians in a more effective manner. We're not going to be able to change the educational, I guess is what I'm trying to say. We're not going to be able to find a bunch of people laying around that aren't working today. But what we can do is we can apply technology in new ways that will allow those people to be more efficient and effective in their roles. If it's analyzing data, if it's documenting, if it's working with the patient in front of them, or identifying the patient that's in most need of care. Those are the ways that AI and digital are going to be able to affect the way that we deliver care today.
That's interesting, the physician shortage that you're bringing up. During COVID, we saw a huge spike in telehealth. That has calmed quite a bit. It didn't go back to the pre-COVID levels, but it certainly has calmed down to some degree. How do you think that might play into helping with that physician shortage? Because now I can perhaps spread the existing physicians we have around a little differently.
Yeah, it was a really interesting trend, wasn't it? Where you saw it take off during COVID and then it pared down. And I think that what that correlates to is just a difference in goals. Originally, we were very focused on how do we accommodate convenient access to care for patients if they're sitting at home? How do we create an atmosphere where the physicians can be efficient and bounce between calls? And how do we accommodate, in some cases, hospital at home, right? Where patients are at home and that's the best place to be if you're sick. And how do we accommodate that? And then all of a sudden it shifted to more of a safety concern. And that drove very quickly the adoption of telemedicine because interacting one-on-one in person was considered unsafe. And especially in a physician office where you're dealing with a lot of sick people. And now we're seeing as COVID has subsided a little bit, we're starting to see those numbers decrease, but it goes back to the goals. So if your organization is seeing a drastic decrease in that, I think you've got to focus on the goals that you have for telemedicine and make sure that you're offering your services with those goals in mind. So offering it with convenience in mind, offering it with the idea of allowing people to stay at home and receive the care that they need. Those That's the focus that I think people need to have on those interactions to be able to reestablish their volumes.
I want to take us back to our earlier discussion about the chief digital officer. One of the things that we're seeing happen in healthcare is the emergence of that position, the chief digital officer, sometimes replacing the chief information officer, or sometimes being a parallel position too. What are your thoughts on that dynamic in the industry, and where do you think it's going to go?
Yeah, it's a really interesting trend and it's all over the place at this point. That's the interesting thing about it. You've got your CIO role, you've got sometimes a CIO paired with a CDO. Sometimes you have a CDO sitting under a CIO, or sometimes you have the CIO kind of transitioning to a CDO title. And it really shows some of the confusion around this space and how people need to address them. At the end of the day, you can look at these different titles. I think what is important, not the title, but it's important that there's some recognition within the organization as to the change that's happening in terms of how we use technology and the acceleration of that change recently. And you can think of that as really something that you have to manage. And it's something that in the past, it was possible to manage it while doing all the other things that a CIO did. And you've been a CIO many times before. I've been a CIO before. And that role is challenging. There's a lot you have to keep your hands around. And the big thing is to recognize that this digital shift is something else to manage and to make sure that you have a point person that is managing it into the future. Because I don't think that this trend is going to go away. It's not something that's just a passing phase. And whether you recognize it as a digital shift or however you recognize it's using technology to accomplish things that we haven't been able to in the past. Prior to this, it's often been about how do we record information? How do we capture data? Now it's how do you use the data to make an impact? And that's exciting to me. But I think if organizations don't recognize that and they don't have kind of the one throat to choke mentality and someone that's in charge, what's going to happen is they're going to miss the opportunity to structure it in a way that's sustainable. And they're going to look back and say, oh, wow, look at where we've gone and look at all the different technologies that don't align and don't really work in our technology stack. So that's how I see the evolution of the role, but where it sits and what it's called is not necessarily apples to apples from organization to organization. What do you think? Can you see in this trend too?
Yeah, I would agree. I see them in largely as complementary roles, not controversial roles, if you will. I don't see one replacing the other, but I think they can need to coexist, because one of the things that I think is very different in today's world versus as we, for the past couple decades, have been CIOs, we had a relatively static environment. And what I mean by that is you only had a handful of major EMR vendors. You only had a small handful of PACS vendors. Then you can go right lab systems, same thing. You go down the line. In today's world with the digital technology and things like AI, it is almost impossible to keep pace with the startups and trying to figure out what is a good decision today. 6 months from now, half of those companies won't even exist, and there'll be twice as many new ones out there. And so trying to sort through that, I think, is really a challenge. And to put that also on a CIO, I think, is a bit much of a burden.
Yeah, I would definitely agree.
So as you look at digital transformation, what do you think the biggest challenge, couple biggest challenges that healthcare organizations are going to face?
So you're seeing all this explosion of technology, right? You're seeing people attracted to it. It's people every day. I get asked about AI by someone in terms of how it impacts healthcare, and that's not even within my job. And I do this for a living. I get asked just in casual interactions. Oh, what do you do? Oh, I'm in healthcare IT. Oh, how is AI impacting healthcare? Everyone is now aware of it. and excited about it. They're excited about what it can bring. There's some nervousness about it in terms of what it can bring on the bad side of things, but there's a lot of excitement about what it can do for us and what it can create and what it can change. And the key is to be able to put some reins around it within your organization without diminishing that excitement, because the excitement facilitates change, right? And that change is going to be necessary. You're going to be changing all kinds of things with each piece of technology that you implement. You're going to be changing workflows. You're going to be changing how handoffs are made between different departments as patient self-scheduling versus calling into the call center. There's a lot of change there, and that excitement helps drive the change. But then there's also some risk within the organization that people are just going off and doing their own thing. And it's important that, again, it's about managing the space. Make sure that you're managing the space and implementing AI in a way that facilitates that change and improves the outcome. So that's one piece of it. And then there's like the auditing side of things. People don't recognize the need to audit these AI models and to make sure that the quality assurance piece is there. Oh, this is making my job easier today. However, you can have creep from the implementation of a model over time that changes the way the model interacts with you. And it's important to understand that creep can be driven by underlying data changes in terms of how your EHR is collecting the data, in terms of where you're getting data outside the EHR. And without recognition of the potential for error, and with AI, that potential can be much larger than just a one-off mistake, right? Because you're not just changing how you interacted with a patient, you're changing how you interacted with 1,000 patients that the AI model taught. And I think people need to understand that and put those guardrails that we talked about in place to ensure that they're getting the advantages of AI and digital without some of the potential consequences.
Look into your crystal ball for a minute relative to AI, and where do you see the FDA and other governmental organizations perhaps helping to put some of those rings around it?
Yeah, so the FDA has talked about making it a medical device. I think most of our listeners probably have heard that. And I think that's a good step. When you think about how we monitor biomed devices, how we audit them, it's very similar in nature to what we're going to have to do with AI to make sure that you're not creating hallucinations, which are kind of errors in how the model's performing, making assumptions, and make sure that it's performing as you anticipated when you first implemented it. So that's a good step. I'm concerned that the regulations are going to be too constrained or constrain health systems too much in regards to the implementation. I think that's something that we'll have to see, but I think the sky's the potential, the sky's the limit in terms of the potential of AI in healthcare, in terms of its ability to accelerate our journey towards a quadruple aim. So the cost of care, the care experience, the quality of care, and the burden that the care places on our healthcare staff. When you think about all the different use cases, they can touch every single aspect of the quadruple aim. And that's really powerful. But if we start to restrict it too much, it's going to get burdensome, and healthcare is not going to a lot of funds, a lot of resources to sitting on the sidelines, if you will, to apply to additional auditing. So it's going to be a challenge from an oversight standpoint to hit that mark just right. And we're seeing that with cybersecurity too, aren't we? In terms of kind of some of the conversation going on now around the Change Healthcare breach and what needs to be done to ensure that doesn't happen again. I think AI may follow a similar track in that regard. But your thoughts?
Yeah, no, I think I'd align with that. I think the challenge is most organizations are hoping that there is some significant application of AI in a clinical setting. for the most part, what you're seeing coming out these days is generative AI. That's how do I clean out my inbox faster, help me compose a response. You're talking about cyber, but I've also seen applications where it's doing helping with claims fraud analysis, expediting that. While I think we all are hoping for the clinical benefits, what we're seeing is a fair amount of administrative applications at this point.
Yeah. And it's not, I guess my thought, that's not necessarily a bad place to start because it gives you a chance to lay that foundation, to try it out. Whenever you implement anything in a clinical setting, the risk is then to patient care. So I think that's prudent, but you're right. The real power and what we're all wanting to see is how can we really impact the health of a population or how can we impact
Exactly.
disease? Right. And some smaller examples of that, but you're right. It hasn't really taken hold there at this point.
You touched on data analytics, data science early on in some of your comments. We've focused now on AI and digital transformation. We already have very large databases, and this new technology that you're discussing is only going to amplify that quantity of data. Talk a little bit about how we, to some degree, have to go back to the roots and figure out what we're going to do with actually applying that data.
Yeah, it is an interesting problem. We started with just using the healthcare data in the ASR, and you can see this reflected in data warehouses too. Many data warehouses were just focused on how do we record all this data that we're gathering during the course of a visit, and then capture it and make use of it. And very quickly, we saw some majority, I would say, of the analytics shop throughout healthcare start to look at how to build an EHR that encompasses more than just the clinical data or just the EHR data. And that's expanded quickly. And our focus from an analytics standpoint is now on making sure that they're capturing all the pertinent data that could be useful. Because if you buy into the concept of learning health system, the philosophy is to capture as much data as possible, then make use of it in a way that allows you to better predict what's going to have success in the future. And that could be anything from social determinants to habits. You think of wearables and things of that nature, EHR data, social economic data. It's a lot of data that we're collecting at this point, and it's just going to keep growing. And I think some of the shift to the cloud will make that a little bit easier, allow us to be a little bit more agile with the data we're collecting, allow us to experiment a little bit more and spin up and spin down different experiments and continue to learn from those use cases, what and how we can use data and where we have success in creating predictive models and creating alerts for decision support and otherwise. It's no longer possible for a physician to be able to consume all of that in the course of a visit and be able to say, oh, this is the best course of action. But what we should be able to do is consume all of that in a model, give the physician information in regards to where to look or where we think to look, and have the physician then take a look and say, hey, this has been helpful. It's like a physician assistant in AI. And that's exciting to see us turning that corner and making use of that information. But it is a burden in terms of the amount we're collecting.
There's a school of thought that talks about artificial intelligence. AI is better to phrased as augmented intelligence to help folks do what they do best. And I think the application of that data and applying that is going to fit in that category. If you had, let's role play for a minute. And Aaron, say I'm the CIO and I invite you in and I'm interested in digital transformation and I don't have a clue how to tackle it. Give me a couple ideas in terms of, Bill, where are you going to start?
Yeah, I think I'd say, Bill, one of the first things we need to do is talk about what your organization's risk tolerance is and what policies we need to create to really some guardrails around where you're going to use AI. What AI or what digital technologies do you have throughout your health system today? We do an inventory. And then it's after you have that foundation laid, and you talk a little bit about governance, because that's important. How are you going to establish the governance over those policies? Then it's about understanding what's available to you and creating a roadmap of maturity. So we sit down and we say, okay, what are some of the problems that we have today? And where are they in terms of your organization? Where can we take different technologies and apply those technologies to those problems? And as you said, I think you said earlier in the call, there are so many new technologies out there that it's difficult for you, Bill, to keep track of all of them. And but I do that every day. And you need a partner that is in that space, looking at those technologies, understanding them, understanding the benefits of them, understanding the pitfalls of some of them, and can really help sort out the maturity model and the solutions to help you get to where you want to be in terms of that maturity. And that's, I think, the first step. Then it's starting to understand how you can apply those technologies in a way that achieves the desired outcome. So all about change management and making sure that you have that set up within your organization and you're cultivating that excitement that we talked about before in regards to facilitating that change. So where we'd start and identifying some particular use cases in terms of where you can apply the technology is key and one of the first steps.
Any cautionary notes? And you touched on a little bit about saying what the guardrails were, but what would you provide me with caution? Say, be careful, don't do this, or don't go too fast there. How would you counsel me on that?
Yeah, I think the cautionary piece is make sure that you're managing it. Make sure it's not happening to you. There's so much excitement around this space that you can often find organizations where they've already brought in technology. They're already using it. Make sure that you're open to understanding how they're using it and that you help guide them in the use and the application of digital technology, including AI. Because if you just put a hard line and say, we're not doing this, you can't do this, it's not going to work. They're going to find a way. But if you become a resource and you show that you can be a partner in the space and you have resources to be able to apply to the problem they're trying to solve, then I think it creates the atmosphere where you're going to work together. You can avoid the pitfalls while still moving things forward.
Yeah, I agree with you there, Aaron. It's in your face constantly in today's world. I remember watching the Super Bowl, and I was just amazed that every single commercial that came on referenced AI. I don't know whether they actually used it or not, but boy, they certainly played to it, and every single one had an AI aspect during the commercial. So interesting. Yeah, and you're right, because I think a lot of individual areas in healthcare organizations are going to be approached by here's a new mousetrap that is AI enabled, and you have to use this because this is what it's going to be. So it's going to create a challenge. Where do you see the use of AI and digital transformation? What's the impact you see it having in the next let's go 5 years. I won't go 10 for you, but in the next 5 years.
Yeah. So I think if you fast forward 5 years in the future, what you're going to see is in some of the clinical use cases that we talked about earlier really starting to unfold. I thought, look at precision medicine, some of the studies that are being done now to be able to understand the human genome, to be able to understand the different effects that disease has on individuals based on their makeup. That's going to be powerful to be able to say, hey, this medicine is going to work for this particular individual. And we have enough data to be able to project that with confidence. In addition, we're starting to see drugs that are actually on time through AI to be able to impact a certain disease. And then finally, being able to project what the impact is going to be on a population, looking across that population to see where we can have an impact, where we can intervene early. So when you put those things together, then you get into the clinical benefits of AI. You're able to project care that's going to be delivered and how it's going to impact an individual. You're able to identify individuals early. And as we talked about before, in terms of being able to assist the physician, because I don't think we're ever going to be able to replace physicians in this way, but we're going to be able to assist them with surfacing pertinent data, with being able to give them more information and combing through information that's pertinent and be able to make that 20 minutes that you have with a patient much more valuable because you're going to be able to see where that patient is in their journey with the medicine that they're and the care path that they're on. And that's where I see it us going. But there's a whole lot of other use cases as well. But I see the clinical piece developing in about 5 years' time.
Okay. Okay. I'm going to apply the same question, but to you personally, and say the chief digital officer in 5 years, what's that look like?
I think it's going to be very similar, although a little bit more commonplace. I think people will start to recognize the need to have someone that is very focused on the AI technology, the consumer facing technology. They're going to start to recognize that it's separate and necessary focus area. And I think that it's there's going to be growth and it's going I hope that it starts to become a part of an organization's strategic plan because recently, with all the constraints put on health systems, with the current financial climate within healthcare, it's become more challenging to utilize technology in a strategic way to differentiate an organization. And I'd like to see us get back there where the CIO, the CDO, those roles are having an impact on how an organization is doing its business and caring for patients and population.
Good. All right. Aaron, we touched on several topics and I really appreciate it. Any closing thoughts that you'd like to share with our listeners?
I think the biggest thing that we haven't covered is just that we need to build a community of people that are focused on this to be able to be successful. There's so much out there. You need to establish your partnerships. You need to understand what relationships you need to have to move forward in the space and strategically position your organization for success. And it's just like moving anything forward. You're trying to take it all on the side of everything else. That's not a recipe for success. So
Sure.
whether those relationships are groups or communities within or informal partnerships or formal partnerships, you need to start focusing on how that can move your organization forward and move your knowledge forward.
Aaron, thank you for the time and your insights. I think it'll be very interesting for us folks that listen to this podcast. And I also want to thank Disruptive Innovations for allowing us to use one of their segments to have this discussion. Have a good day.
Thanks, Bill. It's been a pleasure.